Hi, I'm Dr. Russ, chiropractor and neuromuscular therapist in Portland, Oregon. We're going to look in this video at Sam's hips. She's got a chronic hip problem, a lot of pain on the left side that tends to go down the IT band toward the outside of the leg. Worse when she's been sitting all day, which she says is about 4 days a week. And she's got a long history of interesting hip stuff. She says she used to fall asleep as a kid in lotus position with her legs crossed and folded forward, which is pretty unusual. So let's look and see what we have going on here. And all we need to do is look at the very top of her sacrum and her hip bones, and we can see some asymmetry. Let's get a close-up here. These dimples here, where her SI joint is, clearly a little bit lower on the right side. And you can get a sense of her sacral base right here is tilted lower on the right, and she does seem to have a little bit of edema right over her sacral base here. So something's going on with the sacrum and the sacral fascia. When there's irritation in this fascia and congestion, that's when you start to see that little bit of swelling. And if I feel her iliac crests here come down the outside, what I'm getting a sense is a narrower hip on the right side, wider on the left, so her whole pelvis is shifted this way around her sacrum. So her sacrum tilted this way and her pelvis shifted this way. And we don't have x-rays, but my feeling is that in compensation for the lower sacrum on the right, her ilium has shifted up on the right. So her sacrum kind of like this, and then her pelvis kind of like that. But without x-rays you can't be entirely sure. But you don't need to be 100% sure in order to proceed. So let's have you sitting down. Right there, facing away. Okay. Let's turn this way a little bit. So arms folded like this. That way I can reach across her. And I'm going to feel each of these SI joints here, tilting. And I'm going to turn you toward me. Good. And we actually have nice movement in this left SI. And let's turn you this way. And that hardly moves at all. You can see as she turns left, that movement happening here. And as she turns right, about the same degree, very little movement happening here. And the tilting side to side, kind of frozen on both sides, but definitely frozen on the right. So my big goal here, just to get started with Sam, is to get some movement in the sacrum and help to pull this ilium back and down a little bit. So come and lay on your left side. Sam's in a comfortable sideline position, and I've got some oil on my hands. I'm just going to get things warmed up here a little bit first on the right side. And as I'm warming her up, I'm also feeling through the layers of soft tissue with my hands. And definitely getting here where my thumbs hook around the top of her hip bone. A big knot right here. Big knot. If we think about how the pelvis has come up and out on this side, it's kind of come up and out this way, and ask which muscles are going to pull it that way, and that's the deep abdominal muscle that comes in this direction, and that's the internal oblique. And Sam was saying earlier that she loves going to the gym and working out her abs because it makes her hips feel better. So this is a pretty big knot, and I'm going to take my time working through it and not try and force it. But you can see I'm trying to help this ilium rock back and in, back and in, toward the table, kind of aiming this point for this here. Try to get it moving. Good. Sam, you okay here?
Yeah.
Good. I'm going to follow these fibers of that internal oblique up toward the lower ribs where they attach here, and I'm thinking we're going to find some trigger points. When you feel attachment trigger points, that's where the muscle has literally pulled itself off the bone. And this up here feels actually a lot healthier than I thought. As I come a little bit more forward, I'm getting a little action right here. And Sam can feel that.
Yes.
That's nice. So.
You can't.
Good. Good. So it's already a bit softer. Didn't require a lot of aggressive work, just gentle. And here we have just a bunched up muscle and fascia, quadratus lumborum, thoracolumbar fascia. Let's get this foot behind and this one forward. And that just helps to open this up a little bit more. And just a stretch and a gentle push. You okay there, Sam? Is that pretty tender?
Mm-hmm.
Take a nice deep breath here and just let it out. She's having some pain and tenderness here, so I'm not going to be really aggressive or work it much longer, but I'd like to get some length and opening in there. That's good. So let's shift our focus now. Here's her sacroiliac joint right here, that outline of her sacrum, just like that. Let's get this top leg. She's really quite flexible, yeah?
Mm-hmm.
Yeah, got a lot of movement in here. So I wouldn't try, personally, to do one of the side posture sacral adjustments on her. I don't think that's really what she needs. In general, she's really flexible, but she has a lot of, I would say, a pretty firm restriction right here, where her sacrum, at the bottom of the sacroiliac joint, where it meets the ilium. And rather than try and force any movement through that, we'll do an induction where I'm just going to gently push it in the direction I want it to go, which is again up on the right. As I stabilize her ilium here, use a little body weight. It doesn't move very much, but I only need a millimeter to get started. And once it starts to move, you can follow that movement. And there it's starting to move. It wants to come back before it comes up. So we're just going to do that 5 or 6 times. Now, even if a patient's in acute pain and a lot of pain at the moment, you can do this because it won't hurt. Now this is a simple approach, and it would really just be the beginning and one dimension of a treatment for a hip and pelvic problem that had been here this long and was this deeply ingrained. And I would expect over time, as we got her sacrum moving and worked out some of these muscles, that other problems would surface, and as they did, we would work our way through those. Thanks for your time, Sam.
Sure.
Thank you.